Hello, I'm Lloyd Jenkins. I'm the founder of the Budwig Center here in Spain. And today we're going to talk about the top 3 things you can do for cancer patients that are weak and tired and how the Budwig program can help you. Now, a lot of people with cancer, they have low energy, they're lethargic, they're weak, and they need 3 things: potassium, glucose, and oxygen. Those are the 3 things that you have to focus on. That's what we focus on at the Budwig Center. Now, potassium is very important because potassium creates energy. Dr. Michael Greger, he said that only 2% of most Americans are getting enough potassium in their diet. We need 5,000 milligrams of potassium every day. Now, some things that we give our patients that are very high in potassium are like white beans, avocados, Swiss chard, baked potato, spinach, dried apricots, bananas, coconut water. These are some of the highest things in potassium, so we encourage our patients to eat those. Also, we have a little warning: the more sodium or salt that you take in, the more you push potassium out of your body. So even though Himalayan salt and Celtic sea salt, they're very good for you, when you have cancer, you must use that very sparingly because you don't want to upset the potassium levels that you have in your body. Now, we know that a lot of people take baking soda and lemon juice because they want to increase their pH alkaline. But again, baking soda is of the sodium family, so that would not be recommended for people with cancer because you want to keep the potassium up. The next thing is oxygen. Well, Dr. Budwig had that covered. She gave all her patients the flaxseed oil and cottage cheese, which flooded the body with natural oxygen. So her patients noticed an increase of energy right there. Now, the third thing for energy is glucose. Now, when we talk about glucose, most people think of sugar. Well, yes, we need sugar, but not the refined sugar, not the white sugar, the molasses or maple syrup or any of those refined type sugars. We need natural sugar. So Dr. Budwig encouraged lots of fruit juice and lots of vegetable juice. The mitochondria will convert this glucose into oxygen, which will then turn it into energy. Very interesting, when I visited Dr. Johanna Budwig, they were delivering a case of champagne. And I said, "Champagne? You're giving champagne to your cancer patients?" She said, "Yes. A cancer patient that's weak and has low appetite, the ethanol in the champagne will immediately give them more energy and will increase their appetite. And the ethanol doesn't feed the cancer like white refined sugar does." So I thought that was very interesting. Also, she said that every hour on the hour, she gave her weak cancer patients a mixture of raw honey and freshly ground flax seeds. And she gave them 2 or 3 teaspoons every hour. And a lot of them in 2 or 3 days, a tremendous burst of energy following that protocol. Now, these are just a few tips that we shared with you today, but we've got many more exciting videos that have lots more suggestions of how to treat all the different types of cancer with the Budwig protocol. And I'm so thankful that you're watching this video today. I'd like to give you a free Budwig report. You can download that on the link here in the page. And also go ahead and subscribe to our channel because I've got many more interesting videos to come to talk more about how the Budwig can help you. And thank you for watching and look forward to sharing more with you soon.